Some patients with systemic lupus have skin lesions that will improve with treatment that's given for sort of everyday lupus. And sometimes patients have very stubborn and refractory skin manifestations. And so my talk went through how we think about this from the clinician's perspective in terms of trying to find ways to make the skin better. Things that we talked about. One, super important to wear sunscreen. Avoidance of sunlight is one of the best things that lupus patients can do in order to keep their rashes from triggering. Two, quit smoking. Smoking definitely makes lupus rashes harder to treat. It makes patients require more medications, and drugs like belimumab and hydroxychloroquine are way less effective when patients smoke compared to patients who don't smoke. And then also just a good healthy lifestyle, rest, healthy diet, all of those things help make lupus better as well. And then we talked about ways to maximize dosing for drugs like hydroxychloroquine that can sometimes help rashes get better, and what other medications we can add to hydroxychloroquine, such as quinacrine or mepacrin. And then talking about other options that are available, including some of the newer drugs. And then lastly, in my talk, I went over some of the research that my lab does, trying to better understand how the different types of skin rashes in lupus patients are the same and how they're different, and how understanding that difference might help us pick better therapies for patients in the future.